All right, so good afternoon. I just wanted to do an update after meeting with the plastic surgeon. And that is not why I have a bruise here, by the way. My Frenchie, Zimba, he headbutted me, and so now I have a bruise in my chin. So I know, and this is how my face is doing currently. This is after, this is without any sunscreen or anything on, and that's with after I had the 3 BBLs. So I finding that the BBL seems to be more effective for me. So I'll keep you posted on that. But so I just met with the plastic surgeon just as like an informative type thing, because I know that everyone always asks me about facial plastic surgery in Ehlers-Danlos, and I think it's very not really well described. A lot of experience is still needed. So I asked her about it, and she said that in general, they do the neck and the lower face at the same time, which is pretty common for most facelifts, because, you know, if you have like saggy neck skin, that's going to look funny if your face is also, so it just worked out better to do both. And she also said, when you talk about the SMAS versus the deep plane facelift, those are the 2 most common. The deep plane is what is recommended for patients with Ehlers-Danlos, and that's because the deep plane relies on the lower, like the inner ligamentous structures in order to lift the face, whereas it's not relying on the fragile skin that the superficial fragile skin that the SMAS would be relying on. So, and then when I got home, you know, obviously I just looked up the same thing, because a lot of times I feel like when I hear it from someone and I read it, it kind of reinforces everything. And exactly what she said is what most plastic surgery surgeons that deal with Ehlers-Danlos, what they do. And then she was also talking about the BBL laser, which she uses and is fine for patients with Ehlers-Danlos. And then I did ask her, because again, I get that question a lot, CO2 and more ablative lasers, are those safe for patients with Ehlers-Danlos? And so she's going to get back to me on that. So I know I had promised, I just wanted to get back to you on all of that information, and I will continue to report anything that I hear. But thank you so much, and let me know if you have any questions as well. Yeah, so we're kind of getting more answers in this field of medicine now. Talk to you soon. Bye.